Let's bring in Dr. Amish Adalja. He's a senior scholar at the Johns Hopkins Center for Health Security. Dr. Adalja, just 56% of nursing home workers vaccinated. That's really no better than the general population. But they're healthcare workers and they're working around patients. What's going on?
It's something very puzzling because you would expect healthcare workers who have knowledge and who have also seen firsthand the devastating impact COVID-19 has had on the population would be the most eager to get the vaccine. And indeed, if you look at the rate of vaccination among physicians, it's 96, 97% plus. So there's something that's not translating or trickling down to healthcare workers who are non-physicians, and I think it's really deplorable and unprofessional.
I guess many of the RNs are also more eager to get vaccinated. Are we talking about like administrative staff here, the CNAs, the food workers? Who is it?
It really starts to drop off even when you get to nurses, that nurses are not as vaccinated as physicians, and probably there's kind of a gradation where nursing assistants are less vaccinated, administrative and food workers maybe even less vaccinated. But the whole problem is that this is a nursing home. This is a special place when it comes to the impact COVID-19 has had. If you look at our deaths in the United States, so many of them were from nursing homes. So we know these are hotspots. These are some of the most frail people that are most susceptible to death. So you want them to be surrounded by, ideally, fully vaccinated individuals, and you want them all themselves to be fully vaccinated.
Should vaccines be mandatory for nursing home workers?
Absolutely. They should be completely mandatory for all healthcare workers, whether you work in a hospital or whether you work in a nursing home. This is something that needs to be done. If we are to keep ourselves resilient to COVID-19, we have to get vaccine numbers up, especially in healthcare workers.
What will it take? Because when you're describing to me the gradation of those who have gotten vaccinated, that's also a sliding scale of education, doctors being most educated. Is it a matter of education? Is it a matter of comfortability? What fixes this?
I don't think it's a matter of education, because all anyone has to do is open their eyes and look and see how the vaccines have changed the world. In the United States now, if you go to a hospital in most parts of the country, very different in July than they were in January. What's different? The vaccine. And these are healthcare workers, so even if they might not have as much education as a physician, they have enough education to understand the power of vaccines. And they also have their own experiences of knowing what happened in nursing homes early on, knowing what happened. This is just another example of how misinformation has seeped its way into certain of the ranks of healthcare workers, and we have to combat it.
With all these breakthrough cases that we're seeing and knowing that most seniors are vaccinated, are you worried about how these older people in care homes might be impacted if breakthrough becomes more common?
Well, breakthrough cases are going to be there because no vaccine is 100%. But what we're learning about breakthrough cases is that they tend to not be very clinically severe. If you were to see breakthrough cases be significant, it's more likely to be in a debilitated, frail population like that in nursing homes. So this is something where you want to really fortify nursing homes. And just because they're vaccinated, I still think you want to be very careful, because outbreaks can explode in those types of situations, and the vaccine is going to make it very unlikely. However, there are still going to be cases that could be averted, hospitalizations that could be averted in that frail group if you can keep the virus out of those nursing homes by vaccinating all the workers, all the individuals that have contact with the patients.
Dr. Amish Adalja, thank you.